Hi, it's Allison with Kai Massage, and I got a question about how to manage and take care of a bursitis in the knee. And I just so happen to have one right now. And so I have a Baker's cyst going on behind my knee, trying to keep up with my boys during this time of quarantine and doing exercises together. So here is my knee treatment for a Baker's cyst. All right, first things first is we're gonna look at range of motion. So with the knee does knee flexion. So this is my good side. I can get pretty well. Normally if I'm standing, my heel can go to my butt. This side it's a little bit tighter, but where I feel the Baker's cyst is when I go to full flexion range of motion, and then it doesn't really want to extend. What's our goal? Our goal is always to get that heel to the butt on that quad stretch. All right, so the first thing we're gonna do for this quad technique that we're gonna use, you can get something that's a little bit more oily because I'm actually gonna do some cupping so you can see that. So I'm just gonna put some lotion kind of all around my leg here. And then I'm gonna glide up towards my hip bone, right? That's where our quad attaches. So I'm gonna pull up and towards my hip bone. And yesterday when I was working out, I felt some tightness along this outside my AT band. So I'm just gonna work my way down here. Now I'm pressing fairly hard, but it's enough that I'm still breathing through it. I'm not causing so much pain that I'm like, like I wanna run. Granted, it's kind of like, can you tickle yourself? When you're doing self-massage, it's hard to create so much pain that you're doing that, but you want to be able to breathe through it. So here's another spot. My foot is twitching because it's not happy. My quad's pretty tight. So I'm just going to hold it here. Let it calm down. When you're working with the nervous system, you've got to be calm and patient. So it's not a quick fix like we always want. You just got to kind of hold it. So you want to hold it in a way that you can get comfortable, right? So my shoulder's relaxed. I'm pushing with this hand, and my right hand is the tool. So I'm not gonna create like strain in my shoulders with this. And we wanna be able to kind of be in a position that we can hold it for a while. So I'm gonna hold it here. And then as I kind of feel it soften or relax, I'm just gonna kind of wiggle along the fibers. So I've got a little bit of a knot or tightness there. And it's almost like if you had a hard piece of butter and you wanted to just melt it down into your bread, but instead you're using your fingers. So you're using the heat and your own circulatory system to bring blood to that area and some feedback to the fascia and the nerves. And then you're working all those systems together to relax the muscles and reduce some tightness. Okay, so kind of just worked on a few spots here. So now we're gonna get the cups out. Lucky for you, I have nice pale legs. So I don't know if you can see, but we're getting some blood flow. I got some pinkness going on. Now with the cups, these are just silicone cups. We are gonna start down towards the bottom, and you just squeeze it together and then let it open on your skin, and it lifts it up into the cup. And I always start farthest away from the heart and then move towards the heart. So with the leg, we're gonna start towards the knee, and we're gonna come up towards the heart. Now you can go away from the heart, but I just like to zigzag. So we're gonna go across, and you can see good blood flow happening right away here. And we're just gonna zigzag just to get the tissues lifting off of each other, get the blood flow going in between all those layers. And we're gonna come up the side here. Now again, this is kind of that seam of the IT band and the lateral quad. Sorry, you're getting to see a lot of my leg today. But hopefully this helps you with any quad tightness that you have or knee pain. Because again, the quad comes down and attaches over. Now you can see how much suction I have because I can lift and pull too. And that just gives a different sensory input to the system by lifting and creating more decompression. So you can see I've got my leg nice and red. and some good blood flow going there. The tool you can use is our rock blade here. So this is just another way, instead of decompressing with the cups, this is some compression on the tissue, but not a ton. So we're gonna go at about a 45 to the body. And I'm just gonna kind of do a few passes along and just continue that warming of the tissue and increasing of the blood flow. I'm not trying to cause any bruising here. I'm just increasing the blood flow and kind of doing a survey of the land, right? So just like I did with the cups, I found some tight spots. I can do that with this as well. So I've got a spot right in here. So I'm just gonna hold that spot. So I've got a spot right there. It's kind of like a speed bump. As I go up, it's like ba-dunk. So I'm gonna hold it there, and then I'm gonna flex and extend. So I'm extending here. I'm gonna flex through. We're just gonna do about, I don't know, 5 or 6 of these pumps here. Now the first 2, my knee was popping. So I know I've got some tracking issues in my patella after my ACL surgery, and now it's not popping anymore. So some of that tracking is because my quads get tight. And if you watched my squat form yesterday, you'd see that my quads were tight and so were my ankles. So that's why we're also going to do some calf massage today. See which way it's not wanting to move. So it kind of puckers on the skin there. So again, I'm getting through the skin tissue, through the layers of fat, and into that muscle. But there you've got layers of fascia all in between, and so those fascia can kind of pull and bind. So we're trying to figure out which direction that fascia is kind of stuck. So you can kind of see some separation now. Before I wasn't able to do that. And it was pretty locked in tight in this area. Still is a little bit, but it's feeling better to me. And then I'm just gonna go over that IT band.
Working the muscle in all directions. So you frame it in all vectors that the muscle is attached and working with other muscle group.
All right, quads nice and red now. All right, the next step I like to do after kind of the soft tissue is then get my rock floss. With the rock floss, you always want to start farthest away from the heart and then move towards it. So I'm going to kind of start a little bit lower than where my tibia or my shin bone starts. And we're going to wrap it all the way around. And then we're going to do 50% overlay, about 50% tension. So I'm trying to pull consistently around here. Now you can go over the kneecap, or you can go around it and create a hole. I'm gonna go over it just because I feel like it doesn't always track in the right direction. Okay, so now I have it. For those of you that maybe just had surgery or have a lot of pain or swelling, one thing you can do is just do some straight leg lifts here. So relax, flex that quad, and lift. And when you flex, you're trying to press that back of the knee down, right? Which that's where my range of motion is limited right now, but I'm still able to kind of press it down before lifting. Okay, and then you can go to the edge of a table or chair, and you can do some extensions. This is where my knee gets real crunchy. The crepitus likes to talk to me like a Rice Krispie cereal. I like to tell people I'm not wrinkly on the outside, but I'm wrinkly on the inside. Okay, then we go weight bearing. Okay, then we're gonna just do some mini squats. Doesn't have to be super deep, but we're just trying to be weight bearing. If you're feeling really good and you just want to increase some range of motion, you can go into a single leg squat. Maybe you can hear my knee. It's great. So I'm going to take some of my rock pods and I'm just gonna go along the line that I was working earlier. And we're gonna add these along. Now I have lotion on my skin, so I don't need to add lotion, but if you didn't do any massage, you can use a rock rub, and you can just take some of this and put the cup around so you don't have to touch it. So it gets on the outer rim here, and then you can put it on the skin and then press it down. You can pre-plunge and put it down, or you can invert and then put it down. Now that would be your kind of gradient from least suction to the most suction. Now you choose kind of what you can tolerate. And then we're just gonna kind of wiggle. Now, just like I did with the blade to see which direction the tissue is kind of stuck. When I pull this down, I can feel it all the way up the line. When I go out here in this direction, I feel it pulling here. So that's kind of those directions. It's not really wanting to move, which makes sense because when I bend my knee, I am pulling that tissue down and lengthening it. So it's not really wanting to be lengthened right now. So what I'm gonna do is just some heel slides here. Now I'm gonna try to get a full. So this is kind of the motion that I felt the most restricted on. So this is what I'm gonna try to increase. I can also go weight bearing. And this just gets it's some movement prep. So it's gonna get me ready to go do my workout, ride my bike. I'm not gonna do a ton of squats right now because I do have some inflammation. But if you were doing this and you were feeling good, then this would just be part of your warm up before you went and worked it out. The fun part here is as we take them off, you can kind of see the colors, especially on my pale skin. It's going to show up a little bit more on me. Okay, so now we check my range of motion. That's feeling a lot better. Okay, so we're going to take our tape and I'm going to try to show you. So as we had cut, we created all these different sections, okay? So the goal is to create a basket weave over the Now I'm going to take each strip and I'm going to spread them out. Then we take the other one and we're going to try to bring it over to the other side. So this I'm going to try to avoid the crease of my knee, but I want it to start on the skin. So I'm going to try to line it up so it's all on the skin.
Now I have all the fingers still attached, so I'm going to pull those up, pull the paper up from those. Okay, so I have that, just so you can see. Now as I pull it, we're going to try to get it all the way over, so you can see, and so it's on the skin. Okay, so we're not on the paper on my skin, and then we're going to take these little fingers, and we're going to spread them out.
Okay, so there's my basket weave. Now we're just gonna smooth it all down. All right, so now with this edema tape, I'm gonna go throughout my day. I'm probably gonna put a compression sleeve over top of it just to continue to pump that blood because it's on my lower extremity. And then tonight, I can take that compression sleeve off, but keep the tape on for 3 to 5 days. And it just continues to pump out that fluid so that my Baker's cyst can go down.